Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Anwar Shahzad. Today we will discuss a very simple but important topic, that is fluid and electrolyte balance. We will focus more on one variety, one part of this topic. That is, a person comes to us, he or she is deficient, having in fluid and different electrolytes, maybe having acute gastroenteritis, diarrhea, vomiting, or starvation, or any other illness that the intake is low, so that he or she needs some fluid and electrolytes, because the fluid, the part of our body by weight, 2/3 is the water. So it means water is very much important. It is part of our body and part of the body functions. So, and most of this water is inside the cells, that is intracellular fluid. And out of the remaining, some is in the interstitial space, there is interstitial fluid, and some other less quantity is in the vascular compartment. So it is the vascular compartment where the fluid, being the part of the blood, circulates through the body, and where the water, other electrolytes are needed, they are used, and of course the supply is done by this blood, which also consists of much portion, that is 55% or so the content is plasma and mostly the water. So for the circulation of the nutrients and the waste products and other, the blood is needed, and blood consists of, again, the fluid and electrolytes and cells. So water is very much important for our body, and electrolytes also. So it means that we normally take it easier, and we don't much focus or concentrate on this fluid and electrolytes, and do not know how much important they are for our body. Even they are so important that the life cannot be possible without them, or deficiency and excess of these fluids and water may cause different complications, which may be much serious. So being a clinician and even being a layman, we should think, or we should concentrate on the things, that anything which is needed by our body is important. And the part which is simply available, this water and electrolytes, they are not luckily much costly. So we can have water intake and electrolytes intake. But when there is vomiting, excessive vomiting, the patient cannot tolerate fluid and diet, and more diarrhea that cannot be stopped immediately. So there is loss of water and electrolytes, fluid and electrolytes from the stomach and gut and etc. So in this condition, we have to give IV fluids and electrolytes to the patient, and keeping nil by mouth. So we should know what fluid should be given in what condition. So by this purpose can be solved by knowing the composition of the different fluids which are available in the market and their indications. So today we'll just discuss one of them, that is dextrose water. That is, dextrose means glucose, and water means water. Of course, the glucose is dissolved in water, and the IV fluid is prepared. That is the 5 grams in 100 ml, or the 50 grams in 1000 ml. That is IV fluid which we use in routine clinical exam this purposes. But when we give this fluid IV, when it enters the blood, the glucose portion is metabolized, and the water remains. So now this becomes hypotonic. And because this becomes hypotonic, and it will more be available, which will leave the intravascular compartment and will shift to the cells or the interstitial spaces. and can cause edema, even the edema of the brain, and that may lead to the fits. So, though it is minor, these seems to be very minor things, but they are considerable and they are very important. And if, for example, if you give this water drip to a patient who is head injury, etc., then will lead to more edema and complicate the condition. So, when we give the fluid, IV fluid, we should know that what is the composition of the fluid available and to whom we have to infuse this fluid, and what type of fluid should be infused or given to the patient, so that instead of being benefited, patient may not get worse. So this is a very important topic. That is, one should know the balance, the this considerations of the fluids given IV and in the routine clinics. Although it is a luckiest thing that by giving small amount of fluid, any fluid that can be tolerated by the body. But if you give any fluid in more quantity and that is not indicated, that is not required, it will give may lead to the complications. So by giving before you think that the IV infusion should be given, you should calculate in that how much and what type of fluid should be given. So we just talked about the dextrose water, which has got a few indications that for the nutrition purposes and for the hypernatremia. And even if you don't have any other, then up to 1 liter you can give any fluid, but this should be calculated, and that is better if you discalculate an amount of fluid and the type of fluid which has to be given to the patient. So with this, I will request to subscribe my channel and to like it and share with others, so that the message, which is in a simple language, should reach to the every person who should have knowledge about this medical thing. Thank you very much.